Welcome back. And Eye and Health. Carotid artery disease is responsible for up to 1/3 of all strokes. That's according to the CDC. 3% of adults over the age of 65 have it, and they don't even know it. So here to tell us more about a first-of-its-kind treatment option here in our area, we have the Director of Neurointerventional Radiology over at Jupiter Medical Center, Juan Gomez. Doctor, thank you so much for being here. Let's talk about first what this disease is.
Thank you very much for having me. Carotid disease, just like any other vascular disease in the body affecting, for example, the heart, the blood vessels in the legs, is part of a multisystemic disease leading to narrowing of the blood vessels. In this case, the carotid arteries are the most important blood vessels supplying the frontal center part of the brain. Okay? And the incidence is roughly 3 to 6% of patients will have, in the general population, carotid disease. However, the incidence increases as we age. So as population is getting older, and up to 10 to 15% of patients over the age of 80 will have some carotid disease. As with heart disease or vascular disease affecting the legs, we have medical risk factors, we have lifestyle risk factors. Which are the medical factors that are the most important ones? I remember as the bad H's: high blood pressure, hypertension, high cholesterol, hypercholesterolemia, and high blood sugar, diabetes. Equally important are going to be the lifestyle risk factors, which are cigarette smoking, which is devastating for health. If you smoke, you need to quit. And sedentarism, which is strongly related with obesity and obviously lack of exercise. The American Heart Association will recommend 30 minutes at least 5 times a week, which is a significant amount of exercise, and that's for every single person. So both the medical risk factors and the lifestyle risk factors need to be addressed equally. It doesn't matter. I mean, there's no use or there's no significant reduce in stroke if you just take care of the medical risk factors.
Such a strong message over there, Doctor. And you know what's so concerning about this disease, as I mentioned a few minutes ago, that a lot of people don't know that they have it. Let's talk about the symptoms, though, to look out for.
So just like with diseases affecting the blood vessels, this can be it is a devastating silent disease, which in most cases it is asymptomatic until it is not. And when it is not, you're basically talking about somebody having a stroke or stroke-like symptoms, also known as a TIA, or transient ischemic attack, which is stroke-like symptoms which resolve within 24 hours. That's why it's so important for the population, like a community, to understand or to know what are the symptoms of stroke.
Yeah. And we're looking at it right now. You know, a lot of people know it as Be Fast, and those are some of the symptom samples on your screen to look out for. So something that's so important to take note here. Doctor, as we move on to our final question here, I think it's so important to talk about the new treatment options that we have at the hospital. So tell us what that is.
So we're very excited about this new carotid artery intervention. It's all called NeuroGuard, in which basically we do carotid angioplasty, basically dilating the blood vessel of the carotid and putting stent in a 3-in-1 single device. Typically, when we're going to put a stent in somebody's carotid, we need 3 devices. A filter, which is like an umbrella that we deploy in the carotid artery to catch debris at the time of the stent deployment. Then we use a balloon to dilate the blood vessel. Then we use a stent to keep the blood vessel open. With this device, it's all in one. I can deploy the filter, I can dilate the blood vessel and deploy the stent at the same time. It takes us less than 1 minute to do so. Therefore, the risk associated with the procedure significantly decreased, and the clinical trials with this device have shown incredible results with very, very low incidence of a complication. And we're excited at Jupiter Medical Center to be the first facility in the South Florida to place them.
That's so
and we have some of the largest number of cases so far in the state.
And what's the recovery like for something like that?
The procedure, you come in the morning, procedure is done awake, so you don't have the risk associated with general anesthesia. It takes us approximately 45 minutes to do the whole entire procedure. Our patients are laying in front of us. We're talking to them. It's a painless procedure. Once we're done, we keep them overnight for observation. There's no pain related to it since there's no cutting. And next day, patients go home and resume all their normal activities.
That's very, very cool. And so amazing that it's being offered right here in our area, Jupiter Medical Center. Doctor, thank you so much for being here to talk about carotid artery disease, the symptoms, the risk factors, ways to prevent it. So important in our Eye and Health segment. We appreciate your time and all you do. And we'll be right back.